Hi, good evening. Dr. Kay here from True Vibe Wellness. I will begin in about 3 minutes. It's given some time for people to clock in and join in. Okay, good evening, everyone. Hi, everybody. Okay, how's everyone doing today? Thank you for joining as you join in. Just waiting for some people to join. Hi, welcome. Welcome, good evening. Thank you for joining. Thank you for joining. Welcome, welcome. Thank you for joining. I'm going to get started in about 2 minutes. Hello. Hi. Just giving it some time. 6:59. Giving it some time for others to join in. I'm giving it some time for everyone to join in. I decided to come on early tonight because I want to see if the internet will be a little bit better. So this is why I'm here. Okay. 7 p.m. Okay. Hi, thank you for joining. Okay, it's 7 o'clock. Okay, I have someone that's going in and out, coming in and out. Thank you for joining. Okay, so it's 7. I want to keep this at least to 20 minutes, 30 minutes the most, because I know you are taking time out of your evening. So I wanted to just keep it brief. Hi, everyone. Thank you for joining. I'm just trying to see if I can add. Just trying to see if I can add. Okay. All right. Let's see. I was just trying to see if I can add my other Facebook page, but I'm gonna just go ahead on here and then I'll share it. I'll share it later to my regular Facebook page. All right. All right, good evening. Good evening. Thank you for joining. All right, so happy Wednesday. It's hump day, middle of the week. Um, Tonight, I'm continuing our discussion on managing diabetes naturally. Last night, I spoke about medications and some side effects that medications give. So tonight I actually want to discuss some other areas that having diabetes affect, and also want to talk about nutrient depletion, drug induced nutrient depletion, because a lot of times the medications that we take can actually deplete some of our nutrients that our body naturally makes, or nutrients that we get from our food. And if we're not eating that food, then we're not having those nutrients. So I want to discuss that tonight. So I would only be taking about 20 minutes, and then I'll leave the floor open for questions in case you have questions. I am actually trying out a new streaming method tonight, so hopefully everyone can hear me well. And if you're commenting and I'm not seeing you, forgive me. I'm probably going to try to see if I can sign in um, on my phone here and see if I can. All right. Okay. So, all right. I'm just going to go ahead. All right. Hopefully you guys can see me. All right. I know the past 2 nights I've been on at 8, so maybe that's why some reporters waiting for 8 o'clock. All right, so I'm gonna go ahead and just can ask questions after, or you can inbox me. So this is Kay McDermott with TrueVine Wellness. I'm here discussing managing diabetes naturally. Um, I already mentioned, past 2 nights that 90 to 95% of people out of 100 have are diagnosed with diabetes type 2, which is adult onset insulin dependent diabetes, non-insulin dependent. So some other things that diabetes can affect is the eyesight. Someone who have actually really gone to far loads of having diabetes, like it's very chronic, their eyesight become affected. It can affect the eyesight, causing what they call diabetic retinopathy. So where the cells of the retina accumulates sorbitol, which is a form of sugar, increasing osmosis. If we take it back to chemistry or take it back to biochemistry, um, or biology, osmosis is basically when a substance is moving from one gradient to the next. So that's basically from a lesser concentration to a more increased concentration. So causing water to build up in the cell, and which increase water pressure in the eyes, right? So that pushes out important antioxidant called glutathione and some others, and then creating issues with the eye. So if you're having like blurry vision, or you just have diabetes but you're not having that affected as yet, your eyesight is not affected, go to your ophthalmologist and get your eyesight checked. Because if you're having blurry visions, or you're having vision issues, especially if you're already having diabetes, that means diabetes is already affecting your eyesight. Okay. Another place that blood sugar can affect is your nervous system. So within the nervous system, sorbitol, which is a form of sugar, can build up in the nervous system, creating nerve damage, which is diabetic neuropathy. So this is where you get the pins and needles. You're getting decreased sensation in your feet and your toes. And this can include loss of vibration in toes, loss of ankle reflex, numbness, burning, and prickling sensations can occur. So this includes, vascular disease, which in addition to diabetic neuropathy and vascular disease, this can lead to foot amputation. So you have some people who have diabetes, and if they have it chronically, this can actually cause them to have their feet amputated, right? Because of the stagnation, the circulation is not going as well. um Let me see something here. Sorry. I'm sorry, guys. Okay. Yeah, so that's neuropathy. So Neuropathy can get so bad enough that it can cause bladder dysfunction, and resting fast heart rate, in heart rhythm, I should say, where you're basically called palpitations, but are, or should I say tachycardia, so you have fast heart rate, and lack of peristalsis in the stomach, which is also called gastroparesis. So basically, the stomach is not working the way it can, where it should be. So if you're having this issue, this can also cause, this is neuropathy caused by diabetes. And there's other issues that are causative factors as well. But tonight I'm just focusing on diabetes type 2. Other organs that can be affected is the kidneys. That's where you also it's called diabetic nephropathy. And this is where the kidneys are affected. So someone who may have chronic disease of diabetes, their kidneys can be affected immensely if their diabetes, their blood sugar level is not being managed carefully. So this can also lead to end stage renal disease. So you may have someone who have diabetes and they're taking they're doing dialysis, right? Because their kidneys can no longer function on its own. So they have to go in for dialysis a couple times a week or a couple times a month just to keep their kidneys working properly. So you don't want to wait till it get to that point. You want to make sure if you have diabetes, please manage it. Please take care of yourself and don't ignore it. Don't ignore it and think, okay, I have to have this thing. My mom had it, my dad had it, so I have to have this thing. I'll die with this thing. No, this is not. This is why I'm here to say that diabetes is a condition that can be reversed. Type 2 specifically. Type 1 is a little more complicated. That's something that you're more born with, and that's something you just have to be managed a little bit differently. So because of the kidneys being affected, this can actually lead to high blood pressure because your kidneys do participate in the management of normal blood pressure levels. So if your kidneys are not functioning the way that they should, this can cause increased blood pressure, because too much fatty acids are deposits in the cells, which is also called hyperlipidemia, right? So go back to day one, I was speaking about, I was speaking about having, the triad: blood pressure, diabetes, high cholesterol. So these are the three main areas that diabetes affect: the eyes, causing diabetic retinopathy; two, diabetic nephropathy, affecting the kidneys; and diabetic neuropathy, basically causing nerve damage, affecting the nervous system. Okay, so now I'm going to talk about nutrient depletion. So some medications that, someone with diabetes type 2, are things like metformin, glucophage, which is in the biquinides category. And this depletes folic acid and B12. Um, B12, folic acid is a type of B vitamin, is vitamin B9, which helps your body to produce and make new cells. It also helps your DNA to function optimally. So folic acid is important. And it prevents changes to DNA that can lead to diseases, right? Things like cancer, things like that. So it's important that, if you are taking things like metformin or you're taking medication like glucophage, just know that you are depleting your folic acid level. And folic acid is a type of B vitamin that helps to produce new cells, and it also helps with DNA function. Medically, folic acid is used to treat certain anemias, like blood anemias, but it will not treat B12 deficiency. So don't think if you have a B12 deficiency, don't say, okay, I'm going to take folic acid. No, that's not going to work, right? So there's some foods that contain folic acid that can help in besides taking it supplementally, you can also get it through your foods. So some food content is beans, peas, lentils, oranges, whole wheat products, liver, yes, liver, make sure it's grass-fed organic liver, asparagus, beets, which I love, it's really great for the blood, broccoli, which is another great one. Actually, I'm going to talk about that in another category, but broccoli can do so many things. Brussels sprouts and spinach. So these are the list of foods that contain folic acid. And it's really important that you consume these, in your foods on a weekly basis, day-to-day basis, especially if you're taking medication like glucophage and metformin, because these drugs are actually depleting your nutrients of folic acid. Hi, Dr. EJ. Thank you for joining. Um, So that's that. So then the next category of diabetic medication is sulfonylureas. I mentioned this last night. Glypyride. This is basically your glypyride, your glimepiride, glipizide, amaryl, glucotrol, glycinase, and myronase. These are in that category of called sulfonylureas, and they actually deplete CoQ10, coenzyme 10. Our body naturally makes coenzyme 10. But as you age, as we get older, also having certain conditions like diabetes, because you're taking certain medication, it actually depletes the production of CoQ10, right? So, um, oh, I'm sorry. I need to do B12. Sorry. Let's go back to B12. I'm sorry. All right. So, let's rewind because I'm skipping here. Um, this is why I have notes, all right, to remind me. So going back to the biconides, metformin, and glucophage, it also depletes vitamin B12. Vitamin B12, I'm sure a lot of us have heard of that. It's also known as cobalamin. It's a water-soluble vitamin. It's important in fatty acid and amino acid metabolism. It plays a very important role in producing red blood cells and DNA, and it also helps with proper function of the nervous system. So I don't know what, anytime you go to, you may go to like one of your naturopathic doctors or go to integrative doctors, and they may mention, hey, take a B complex or take B12, because B12 is, they say it's good for energy, it's good for nervous system, right? So B12 is really important for the function of the nervous system, and it really plays a really important role in making red blood cells and DNA. And your DNA is important because your DNA is what makes you you. Your DNA is what makes your eyes, your teeth, your tongue, your nose, your everything. Everything about you is DNA. Um, right? So B12 is naturally found in meats, fish, poultry, eggs, and dairy. So now, if you decide you want to go along this route and you don't want to consume more meat, you want to consume more fish, you want to consume more poultry and eggs and dairy, I would recommend make sure you're doing organic meats. If it's beef, make sure it's grass-fed, grass-finished beef. If it's fish, make sure it's wild caught fish. If it's poultry like chicken, make sure it's cage-free organic chicken. Eggs, same thing. Make sure it's free ranged organic eggs. And dairy, you want to make sure it's grass finished dairy. With some plant-based milks, some of them are actually enriched with B vitamins. But you can, again, you can incorporate these type of foods in different ways, and just make sure you still incorporate your vegetables with it. If you have like symptoms of B12 deficiency, or you're not sure if you're B12 deficient, the most effective way is go and get blood work done, and and check your B12 levels. You can check your B12 levels, by your blood. Some symptoms of B12 is pretty common among people, especially with diabetes, and they're on these kind of medication like the glipizide and so forth. Is if your skin is pale, you have jaundiced skin, weakness and fatigue, right? So remember, I said, I think the first night I mentioned that weakness and fatigue can also be caused by iron deficiency, or can be caused by thyroid dysfunction. So again, it's always good to, if you specifically have diabetes, it's good to get your B12 levels checked, because your B12 levels may be fine, right? Even though you're on some of these medications. So before you quickly want to go and get, take B12, make sure you get that checked. So some symptoms of B12 deficiency is sensations of pins and needles and nerve damage. And says some changes which can cause changes to mobility due to the long-term effects of nerve damage. So you mostly find this among the elderly. Anyone above 60 years of age, you find them having these symptoms: the pins and needles, the changes to mobility, because there's nerve damage. They can't move as effectively as they can. So again, before you go ahead and run to go take B12, make sure that you get your B12 levels checked. Also, I wanted to point out to one of the symptoms of B12 deficiency, sensations of pins and needles and nerve damage. But remember, diabetes itself can damage your nervous system and cause the same symptoms, right? So it's really important that you get your B12 levels checked. I advise that you take methylcobalamin and not just regular cobalamin. And like in multivitamins, you'll see cobalamin, or you have some multivitamins that already has it methylated. Methylation is basically a process that enhances the biochemical pathways in our body. right? So it enhances detoxification, it enhances the heart, the nervous system, reproductive systems, right? So, and also methylation is not something that's easy for everybody, believe it or not, even though it's something that should be naturally taking place in our bodies, but not everyone can methylate. So if you're looking for a B12, make sure it's a methylated B12. Okay. All right. So methylation turns our system on and off, and methylation actually plays a huge role in our DNA making. Probably one day I'll probably do another talk on genetics, but methylation is a huge plays a huge role in detoxification and in our DNA. All right. So the next thing now I can talk about CoQ10. So coenzyme 10 is depleted by sulfonylureas, which is your glypyride, your glipizide, your amyl, your glycines, right? So just a quick recap. So metformin and glucophage, which is your biquinides, depletes folic acid and B12, and your sulfonylureas, which is your glypyride, glimepiride, sorry, glipizide, amyl, glucotrol, glycines depletes CoQ10, also known as coenzyme 10. So coenzyme 10 occurs naturally in the body. Our body makes it. It's an antioxidant. It acts as an antioxidant, so it protects the cells from damage and plays an important role in metabolism and energy, right? So especially also if you're someone who have high cholesterol and you're taking cholesterol medication also depletes this because it actually works out in the same pathway, right? There's a pathway in cholesterol making that actually branches off to CoQ10, but that medication, if you're taking cholesterol medication, it breaks off that pathway. So your body's not making it. But also has diabetes, some of these medications, you're taking those sulfonylureas, it's depleting your CoQ10, and also as we age, the production of that depletes. So food sources of CoQ10 is cold water fish, such as tuna, salmon, mackerel, sardines, meats, vegetable oils. And again, I want to emphasize fish, make sure it's wild caught. Tuna, you don't want to do too much tuna once in a while because of the high mercury level. And salmon, you want to make sure it's wild caught salmon. Mackerel and sardines, you want to make sure it's wild caught as well. And your meats, you want to make sure your meats are organic meats. Okay. Your vegetable oils, you just want to keep it down to, probably like grapeseed oil or olive oil or, something like that, to keep with that. But if you need more details in terms of oils, you can always send me a message and I can give you my suggestions on, what oils would be best to use, especially for cooking for your salads. So if anyone is taking like blood thinners or thyroid medication, there's an interaction with CoQ10. So if you're taking blood thinners like, Coumadin or heparin or something like that, or Plavix, please speak to your primary care physician first before you go ahead and start taking CoQ10. CoQ10 can also may lower blood sugar levels as well and blood pressure. So, and anyone that are at risk, if you have like chronic heart failure or you have chronic kidney issues, liver issues, you want to make sure you touch base with your doctor first before taking CoQ10. And it also depends on the levels too, of CoQ10, the dosages. So just make sure touch base with your doctor first before you go ahead and run into, taking CoQ10. So CoQ10 is also important for fertility, for egg health and sperm health, heart health. And so evidence has shown that CoQ10 is very supportive for heart conditions, supportive for migraine, supportive for statin-induced myopathy, which is basically, aching muscles, and, muscle pain and Parkinson's disease. So this is just a little sidebar on how important, to show you how important CoQ10 is, right? And also you want to make sure that when you get in your CoQ10, make sure it's ubiquinol and not ubiquinone, because your body has to convert it to CoQ from ubiquinol to ubiquinol. So just make sure when you're going to get your CoQ10, making sure you get the right form, especially once your doctor okays it, you can go ahead and get that, right? If you need more details on that, you can inbox me and let me know. If you need to find where you can get that, you can also inbox me. I can let you know. All right. Okay. And that's it. So that is my tidbit on managing diabetes naturally. And does anyone have any questions? so far has to any questions that anything that I spoke about. Tomorrow I'm going to be talking about foods and spices that are really good for managing diabetes. So things that you already have in your kitchen, possibly, and things that you can incorporate into your diet that can help manage your diabetes. Tomorrow I'll be going into that. But does anyone have any questions from tonight or any questions from past days that I've mentioned? I'm trying to keep this short because short and sweet and compact. I didn't want to, keep in too much detail so I don't overwhelm you guys. But hopefully this is helpful to somebody, and it's enriching you in some way or the other. Does anyone have any questions? I am going to. And also, if you need to book your appointments or you have any questions or you'd like to contact me, you can contact me at truevinewellness@gmail.com or hi, Garrett. Thank you for joining. Metabolic syndrome. That's a tough one. That's a very complicated one. So before, let me just put a plug right there. Anyone want to have any questions, you can email me or email me at truevinewellness@gmail.com or info@truevinewellness.com. You can go to my website, truevinewellness.com, to book your appointment if you want a consultation with me. 30-minute consultation. You can do that as well. So Garrett, metabolic syndrome is very complicated, and I don't know if I have the brain to wrap my mind around that tonight. But metabolic syndrome is something it's really hard for people to manage, because that includes a lot of weight gain and a lot of hormone imbalances. Cortisol levels are elevated. So that's a lot going on there. So Garrett, let's talk on this side about metabolic syndrome. Um, any other questions regarding my family's prone to diabetes? One of the syndrome is central obesity. Right, that is very true. And central obesity also comes from increased cortisol, increased cortisol production, and cortisol is being produced by the adrenal glands. And so also too, if you're not, if you are under some kind of stress too, that can cause your adrenal glands to continue making cortisol. So, for someone like that, if you are prone to central obesity, I will look at your cortisol levels and check to see what your cortisol level looks like, and also just check on your other hormones that your adrenal glands produce, like your DHEA and, testosterone and all that, and just check those levels as well, to see, what that looks like. So Garrett, I hope I hope you check your cortisol levels to see what that looks like, because if you know what your hormonal levels look like, then you're able to manage it and you're able to correct it, right? You don't want to just like start treating or start managing blindly. So it's good that you get your labs checked, make sure check your cortisol, check your DHEA, right? Teach your DHEA levels, check your testosterone levels, and see what that looks like, because all those play a role in fat metabolism, right? So get those checked. Any other questions? Any other questions, guys, regarding central obesity, diabetes? And actually, you do have some people who have diabetes and obesity together, where they're significantly overweight and they also have diabetes. And that's running rampant a lot among our society too, especially in our African American community, unfortunately. And again, that's something that can be reversed. So, any other questions regarding diabetes, managing blood sugar levels, anything? Any other questions, everyone? It seems like you guys are hearing me well today, so I'm so grateful for that. Thank you. This is very important. Oh, thank you. Okay, awesome. You're welcome, Garrett. But Garrett, I'm going to give you a call and see if we can chat about that on the side. Any other questions? Any other questions? I'm here for those who are joining. I'm talking about managing diabetes naturally, and I spoke about the nutrient depletions. So for those who are just joining, you can go and watch the replay. And as I discussed about depletion of B12, CoQ10, and folic acid. And then tomorrow, I'm going to be discussing foods and spices that you can incorporate to help manage blood sugar levels. Okay, and then the last day part, I'll talk about lifestyle and and things that you can include to help with that. Any other questions? 7:27, 3 minutes. I am calling it a night. Any other questions about blood sugar levels? Anything else? Or if you have a random question about something else. Thanks, Mom. Anyone have any other questions about blood sugar levels, diabetes? One day, let me know if you'd be open to me doing something on high blood pressure, high cholesterol. I may not do a 5-day series though. I may just do like one video on high blood pressure and then one video on high cholesterol. And please, if there's something you want me to go deeper into, please let me know. And then I can prepare and then one day come on and talk about it, discuss it a little further. So let me know. Hormone imbalances. I'm very I'm huge on also hormone imbalances. So my focus in my practice is not just endocrine issues like diabetes and cardiovascular issues, but also hormone imbalances with women. So PCOS, fibroids, all those things are things that I love to work with as well. Because a lot of us women go through so many things unnecessarily, and we don't know that we can actually do something about it naturally. We just have to commit to the changes and commit to doing what you need to do to basically reverse that or have a better life with that. Yeah, high blood pressure is very important. So yeah, so I'll probably talk about high blood pressure. I'll come on here probably in the month of June and talk about that, because May is also mental health awareness month. So I want to actually come on here and do something on mental health probably before the month is out. I'll probably have a guest and we talk about mental health as well. So anybody have questions about yesterday? I spoke about the immune system and diabetes and but I also have the videos that are there. The videos are also on my page. So if you want to go back and watch them, see what I discussed and then have questions about that, you're welcome to do that. Please share this video with family, friends, loved ones who may have diabetes, struggling with any health issues. Please share this video with them. You may help somebody. Okay. And again, if you want to pass my information to someone, want to book a consultation with me, your wellness consultation, go to truevallywellness.com and book a consultation, or you can send me an email at info@truevallywellness.com, or you can give me a call at 347-433-5076. All right. So 7:29. There's no other questions. Thank you everyone for joining. It was a pleasure. Thank you for spending your 30 minutes with me. Hopefully everything is well. Women's Month is May as well. Yes, Mom, that is true. May is also Women's Month. And May is also my birthday. So, and Mother's Day and all these wonderful things. So May is a great month. But by the end of this month, I will come back in here and talk about mental health, anxiety, emotional health is important, and emotional health actually can affect our physical health. So it's really important that we discuss that and we don't turn a blind eye to it. We do have a lot of us, not just women, men who experience depression, anxiety, and a lot of emotional and mental stress. So I want to come on here and talk about that. Thank you, Garrett. You're like how many days early? And you come on. I'm going to actually have a guest. Let me see if she's available, and we'll come on before the month is out. I will announce it, but I will talk about mental health because I think it's very important. All right, so thank you guys for joining and tuning in tonight. If you have any questions, again, email me info@truevallywellness.com or truevallywellness@gmail.com. Or you can go on my website at truevallywellness.com to book your appointment. If you also would like to know where to get your supplements, you can also reach out to me as well, okay? All right, guys, thank you for joining. Have a good night. Please share this video. Have a good night. Bye.